Hello, locked-in syndrome is a rare disorder caused by damage to an important part of the brain called the brainstem. In locked-in syndrome, all of the muscles are paralysed except for the muscles that control the eyes. People with locked-in syndrome are fully conscious and can think and feel normally, but they cannot move or speak. They can only communicate by blinking and moving their eyes. Locked-in syndrome has several different causes. These include stroke, bleeding in the brain called a brain hemorrhage, traumatic brain injury such as hitting your head in a car accident, brain tumours and infection in the brain. Unfortunately, there is no cure for locked-in syndrome. Treatment focuses on helping someone to breathe and feed. Often people need the help of a breathing machine, which has a tube that passes through a small hole in the throat into the windpipe. Eating can be dangerous as swallowing is affected and food may go down into the lungs and cause a chest infection. Therefore, a feeding tube is placed that passes through the skin of their tummy and directly into the stomach. Speech therapists work closely with patients with locked-in syndrome to help them learn to communicate by moving their eyes and blinking. Computers using infrared eye movement sensors and artificial voices now allow patients with locked-in syndrome to communicate more easily. Recovery of normal speaking, swallowing and walking is extremely unusual. The majority of patients with locked-in syndrome can move around independently, most often in a powered wheelchair. However, very few recover enough to be able to feed and dress themselves. Many people with locked-in syndrome live only a short time due to the high risk of medical complications, such as a chest infection. However, others may live for many years with a good quality of life despite the difficulties they face. If you have any questions about locked-in syndrome, please speak to your healthcare professional.